Please see important safety information near the end of this video. Please see link for the full prescribing information, including the medication guide for Skyrizi. Uses. Skyrizi is a prescription medicine used to treat adults with moderate to severe plaque psoriasis who may benefit from taking injections or pills, systemic therapy, or treatment using ultraviolet or UV light, phototherapy, active psoriatic arthritis, moderate to severe Crohn's disease, moderate to severe ulcerative colitis. Safety considerations. Do not use if you are allergic to Skyrizi. Skyrizi may cause serious side effects, including serious allergic reactions, an increased risk of infections, and liver problems. Stop using Skyrizi and get emergency medical help right away if experiencing symptoms of a serious allergic reaction. Before starting treatment, your doctor should check for infections and tuberculosis. Tell your doctor right away about any infections or symptoms of infection, and about planned or recent vaccines. Liver problems may happen while being treated for Crohn's disease or ulcerative colitis that can lead to hospitalization. Your doctor will do liver blood tests before and during treatment and may stop Skyrizi if liver problems develop.
I'm on Medicare. How can I get help understanding coverage options for Skyrizi?
Oh yeah, I just went through this. I take Skyrizi, and when I signed up for Medicare, I wasn't so clear on what's covered, what's not covered. I wanted to get a good handle on all this insurance stuff, so I called Skyrizi Complete. They got me on the line with an insurance specialist, and she walked me through the resources I need to understand my coverage options. And here's the thing, everyone's situation is different, so you gotta consider what's best for you. One of the options the insurance specialist told me about is Medicare Part D. It's a separate part of Medicare you can sign up for that lets you pick a prescription coverage plan. She helped me figure out what to look for. After going through the resources and weighing my options, I felt prepared to call Medicare. It was the right decision for me, but there are other options that may work better for you. My advice, call and ask for an insurance specialist. They'll get you what you need to consider your options, and then you're on your way. Here are a few things to help you get started. Call Skyrizi Complete and talk to an insurance specialist. Ask about your insurance options and what to look for when choosing a prescription plan. Consider Skyrizi coverage and out-of-pocket costs. If you want to sign up for prescription coverage, call Medicare and pick your plan. Don't forget to call 1-866-SKYRIZI and speak with an insurance specialist.
Important safety information. What is the most important information I should know about Skyrizi, risankizumab riza? Skyrizi is a prescription medicine that may cause serious side effects, including serious allergic reactions. Stop using Skyrizi and get emergency medical help right away if you get any of the following symptoms of a serious allergic reaction: fainting, dizziness, feeling lightheaded, low blood pressure, swelling of your face, eyelids, lips, mouth, tongue, or throat, trouble breathing or throat tightness, chest tightness, skin rash, hives, itching. Infections. Skyrizi may lower the ability of your immune system to fight infections and may increase your risk of infections. Your healthcare provider should check you for infections and tuberculosis, TB, before starting treatment with Skyrizi, and may treat you for TB before you begin treatment with Skyrizi if you have a history of TB or have active TB. Your healthcare provider should watch you closely for signs and symptoms of TB during and after treatment with Skyrizi. Tell your healthcare provider right away if you have an infection or have symptoms of an infection, including fever, sweats, or chills, cough, shortness of breath, blood in your mucus, phlegm, muscle aches, warm, red, or painful skin, or sores on your body different from your psoriasis, weight loss, diarrhea or stomach pain, burning when you urinate or urinating more often than normal. Do not use Skyrizi if you are allergic to risankizumab riza or any of the ingredients in Skyrizi. See the medication guide or consumer brief summary for a complete list of ingredients. Before using Skyrizi, tell your healthcare provider about all of your medical conditions, including if you have any of the conditions or symptoms listed in the section, "What is the most important information I should know about Skyrizi?" Have an infection that does not go away or that keeps coming back. Have TB or have been in close contact with someone with TB. Have recently received or are scheduled to receive an immunization, vaccine. Medicines that interact with the immune system may increase your risk of getting an infection after receiving live vaccines. You should avoid receiving live vaccines right before, during, or right after treatment with Skyrizi. Tell your healthcare provider that you are taking Skyrizi before receiving a vaccine. are pregnant or plan to become pregnant. It is not known if Skyrizi can harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if Skyrizi passes into your breast milk. Become pregnant while taking Skyrizi. You are encouraged to enroll in the pregnancy registry, which is used to collect information about the health of you and your baby. Talk to your healthcare provider or call 1-877-302-2161 to enroll in this registry. Tell your healthcare provider about all of the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of Skyrizi? Skyrizi may cause serious side effects. See, what is the most important information I should know about Skyrizi? Liver problems may happen while being treated for Crohn's disease or ulcerative colitis. A person with Crohn's disease who received Skyrizi through a vein in the arm developed changes in liver blood tests with a rash that led to hospitalization. Your healthcare provider will do blood tests to check your liver before, during, and at least up to 12 weeks of treatment, and may stop treatment with Skyrizi if you develop liver problems. Tell your healthcare provider right away if you notice any of the following symptoms: unexplained rash, nausea, vomiting, stomach, abdominal pain, tiredness, fatigue, loss of appetite, yellowing of the skin and eyes, jaundice, and dark urine. The most common side effects of Skyrizi in people treated for Crohn's disease and ulcerative colitis include upper respiratory infections, headache, joint pain, stomach, abdominal pain, injection site reactions, low red blood cells, anemia, fever, back pain, urinary tract infection, and rash. The most common side effects of Skyrizi in people treated for plaque psoriasis and psoriatic arthritis include upper respiratory infections, headache, feeling tired, injection site reactions, and fungal skin infections. These are not all the possible side effects of Skyrizi. Call your doctor for medical advice about side effects. Use Skyrizi exactly as your healthcare provider tells you to use it. Skyrizi, Risankizumab Riza, is available in a 150 milliliter pre-filled syringe and pen, a 600 mg 10 milliliter vial for intravenous infusion, and a 180 mg 1.2 milliliter or 360 mg 2.4 milliliter single-dose pre-filled cartridge with on-body injector. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. If you are having difficulty paying for your medicine, AbbVie may be able to help. Visit abbvie.com/patient access support to learn more.